Hi everyone, this is Dr. Nitin Chhoda with Ignition Time and welcome to my channel. Thank you so much for being a viewer. Thank you so much for being a subscriber. If you don't know anything about me, please check out my video. You'll learn more about who I am, what my journey has been like and why you should listen to me. Also, if you learn something new from this video, please consider clicking the like button. Please consider subscribing and enabling notifications. That's your vote of confidence in us and all the effort that goes into this channel behind the scenes. Now, in this video, I'm going to highlight some recent comments from the former FDA chief, Dr. Scott Gottlieb, who warned that we could see a surge of cases, a surge of COVID cases heading into the winter. Thanksgiving is coming up. It's a time when we all want to spend time with family, when we all want to get together, have several people together, including elderly individuals, including elderly members of our family. And this video should serve as a warning about what lies ahead. That's number one. Number two, some important data about vaccines and about the antibody treatment that the president got. Now, this is not about, hey, should you take the vaccine or not? It's, that you can make that decision. This is not about that. This is about trying to provide you with important data. And I promise you, if you watch this video all the way through to the end, you will indeed learn something new. And this video will help you plan for the months ahead. Imagine if we had a video back in February or March of this year telling us about what lay ahead in the next 6 months. It would have allowed us to plan. This video will help you plan for the next 4-5 months potentially. Let's just jump right in. So former FDA chief Dr. Scott Gottlieb is warning that the United States is about a week away from seeing a rapid acceleration in COVID cases. This is frightening. And I have mentioned this earlier. Back in March, the news reported the first case of COVID. I believe it was in California. And at that time, a lot of us were like, we don't know. But now, not only are we seeing a surge of cases in certain states, we're also seeing some individuals getting affected by COVID, infected with COVID a second time, which is why I think we need to be careful going forward. So here's what Dr. Scott Gottlieb said. He said that, everyone has a strong desire to see each other during Thanksgiving, which of course is true. Families coming together. It's very important when families come together to be careful. Especially as far as elderly individuals are concerned. And he did say that 2021 is going to be a better year, much better year, because we will indeed have a vaccine and it'll help those who are most vulnerable, because presumably those who are older, those who are more vulnerable will be getting the vaccine first. So some very important comments about what's likely to happen in the next few months and why 2021 will potentially be a better year. Let's listen to the words of the former FDA chief, Dr. Scott Gottlieb, and let's roll the tape and watch.
Former DEA Commissioner Scott Gottlieb is with us. Dr. Gottlieb, hearing dire predictions for the weeks ahead. What's yours?
We're facing a tough circumstance right now. We're going to see accelerating cases heading into the next 4 to 6 weeks, probably into the end of the year right now. It's going to be a difficult fall and winter. I think we're about 2 or 3 weeks behind Europe. So we're about a week away from starting to enter a period where we're going to see a rapid acceleration in cases. And I think November and December are going to be tough months. We're seeing hospitalizations go up in 42 states right now. Cases are going up in 45 states. And there really is no backstop. The summer was a backstop of sorts to the spring surge. And we have no therapeutic backstop. And the fall and winter season is when this coronavirus is going to want to spread.
We were just live in North Dakota and Wisconsin, cold in both. That brings people indoors. Thanksgiving's ahead. What are you telling families who just haven't seen each other in so long and would love to have 10 people around a dining room table?
Yeah, when you talk to the governors about where they're seeing the outbreaks occur, when they do their tracing and they trace back to where the source of the infection was, oftentimes it's family gatherings, it's gatherings at local social halls, Elks Clubs, things like that. It's not people going into bars and restaurants per se. So I think we need to be careful in those settings where we let our guard down and we think that we're safe. And, we're really coming to what I said this morning was the 7th inning of the acute phase of this pandemic. We've been through a lot right now. We've managed to protect the vulnerable in many cases. And I think we can't let our guard down right now. Thanksgiving is going to be a tempting occasion to bring together families. But if you have older individuals in the family, people who are vulnerable, I think you need to think about how to protect them through the holiday. As we get into 2021, the risk is going to start to recede. We'll have a vaccine for vulnerable populations, hopefully heading into 2021. And, we can look to happier days, but these are going to be some tough months ahead of us, and I think we can't let our guard down right now.
Now, in the second segment of the interview, Dr. Scott Gottlieb said some things that were extremely important and very, very interesting. Now, as you all probably know, President Trump got an experimental antibody treatment from Regeneron. That treatment is not available to you, not available to me yet. And what Dr. Gottlieb pointed out was that this experimental antibody treatment is essentially a bridge to the eventual vaccine. Now, before I continue, let me again emphasize, this video is not about trying to get you to take the vaccine. It doesn't matter to me whether you take the vaccine or not. What matters to me is that my viewers and subscribers have the right information. So don't freak out. Don't blame the messenger thinking that I'm pushing vaccines. I'm trying to give you information from the former FDA chief, and it's important and it'll help you plan for the future. And I strongly recommend that you share this video with a friend or family member, especially someone who's senior, someone who could potentially benefit from this information. This video could potentially help you, and I'm hoping that it hopefully even saves lives. So the experimental antibody treatment is a bridge to an eventual vaccine. But what Dr. Gottlieb pointed out is that this experimental antibody treatment, when it's going to get approved for national use, is only going to be available in a hospital. So an individual will need to go to the hospital. Now imagine if you're infected, when you go to the hospital, you're probably going to need someone to maybe drive you to the hospital. How are you going to get to the hospital? That's number one. Number two, when you get to the hospital, you've got to be hooked up, to IVs and all those things for 2 or 3 hours, potentially longer. So there needs to be a home solution for this experimental antibody treatment, which, by the way, it was provided to President Trump, who had the illness. In the future, it could be provided to someone who doesn't have the illness, because the antibodies essentially mimic the immune response and essentially, become soldiers, if you will, to fight off this illness. So this experimental antibody treatment is essentially designed as a cure, but Dr. Scott Gottlieb talked about potential implications about using it in all kinds of individuals. So I thought this was important. Also, here's another important thing. When the vaccine does indeed come out, somebody gets a vaccine, they have to wait a few weeks and then get a second shot. And then after getting the second shot, it's going to be 2 or 3 weeks before they have, the protection against the illness. This means that we could head into February or March of next year before someone has, quote unquote, protection from this illness, specifically senior individuals. Because remember, seniors are the ones who are getting, impacted the most by this illness. So we could be talking a few months into the future before we have, I quote, protection. And that is assuming everything goes according to plan. That is assuming everything essentially, goes the way we want it to. So again, getting the vaccine, waiting a few weeks for a second shot, then it could be a few weeks after the second shot before you have full immunity. I don't even know if full immunity is possible at this point in time. I guess we'll know in the next few months. This is assuming that we have a vaccine which is safe, which is the most important thing. And as far as antibody treatment in the hospital is concerned, I talked to you about that. There has to be eventually home infusion of antibodies. Interesting comments. I think something we should all know. Let's watch what Dr. Scott Gottlieb said about this subject of vaccines, antibodies, and what the next few months hold for us. Let's roll the tape.
You mentioned a vaccine, hopefully. There's so much talk that it's just going to happen. By the third quarter of next year, there's a vaccine. Can you handicap whether that's a real thing or not? Whether you believe that's a real possibility?
Well, look, people are optimistic based on the early data, but we won't know until we unblind these large trials. I'm on the board of Pfizer, one of the companies doing a large-scale trial with one of the vaccines that's in advanced development. But remember, even if these trials are successful and these vaccines make it onto the market, they're authorized by FDA through an emergency use authorization, the first tranche of patients, the first group of patients who get that vaccine aren't going to have protective immunity into 2021. It's going to be probably February or March before they're fully immune or have the full benefits of the vaccine, because even if the applications get filed at the end of November, which is the schedule right now when it could happen if the vaccine trials are successful, and the FDA takes 2 to 4 weeks to authorize those vaccines, it's going to take about a month to vaccinate that population, the initial population, which are going to be more vulnerable Americans. Then you have to wait about 3 to 4 weeks to get a second shot. Not everyone's going to get that exactly on time. And then after you get that second shot, then you have to wait about 2 weeks to have the full benefits of the immunity. So you're putting the schedule towards February or March when people will have the full benefit of the vaccine, even if it's on schedule, even if things go right and the authorizations happen sometime this year.
You wrote an op-ed that you referenced briefly there about getting treatments to people who need them, but obstacles that stand in the way of delivering.
Right. These are the antibody drugs. And so we always thought that the bridge to a vaccine could be these antibody drugs, the drugs that Governor Chris Christie and the president received. These are drugs that basically give you an immune system in a bottle. You're basically getting an infusion of the antibodies that your body would normally produce in response to the infection to fight the infection. I think these drugs should be available this year. They could be authorized by FDA in a matter of days or certainly weeks. But there's going to be real challenges distributing these drugs. Right now, the system the federal government has designed to distribute these drugs envisions infusing them in hospital emergency rooms. And these drugs need to be given to patients who are infected with coronavirus but aren't yet very sick. In many cases, they won't even be showing symptoms, but they're people who are at risk of having a bad outcome. It's going to be hard to get those individuals to come into a busy emergency room and sit for a 3-hour infusion. Ooh. So I think the government needs to think about how to provide these drugs in a home-based setting, use home infusion services to give these drugs to people while they're in the home. The other challenge is you have to get the people to the hospital. So these are infected individuals that someone's going to have to drive them to the hospital.
Mighty complicated world. Dr. Gottlieb, thank you so much.
That's it, everybody. Let me know what you think about Dr. Scott Gottlieb's comments in the comments section below. You'll see a link. You'll see links in the description to our resources so you can check out this interview in more detail on your own and other articles pertaining to what may lie ahead. My goal is simply to prepare you. My goal is not to advocate vaccines or not advocate vaccines. That is a decision you have to take. But I do think all of us need to be aware of what lies ahead, because the one thing that we lacked in March was knowledge and preparation. Now, I want to give you the insight that you may or may not be able to get from other sources, because this is our channel. The Ignition Time channel is not just a stimulus news channel or an unemployment benefits channel. If you're a subscriber, you've already figured that out by now. If you're not a subscriber yet, please subscribe, please enable notifications, and please share this video with friends and family, because if this video helps even a single individual maybe not get infected or potentially have the right kind of information, then I think we will all have succeeded. Please share this video with friends and family. Thank you so much for watching, everybody. My name is Dr. Nitin Chhoda with Ignition Time. If you don't know anything about me, please check out my video. You'll learn more about who I am, what my journey has been like, and why you should listen to me. We release videos at 2 p.m. East Coast time most days of the week. That's 2 p.m. East Coast time. You can get your cell phone out, send a text message with the word ignition or with the word time to 70,000, that's 70000, and you'll get added to our SMS alerts list. Now, you can also, if you want, get added to our email list. Simply go to ignitiontime.com/alerts. That's ignitiontime.com/alerts, and you'll get added to our email list. You can opt out of the SMS list or the email list at any point in time that you want. No worries about that. Now, sometimes YouTube does not send out notifications as soon as we release videos. So the way around that is simply bookmark youtube.com/ignition time. That's youtube.com/ignition time. Simply bookmark that page, and then you can watch our videos at any point in time that you want. You're not dependent on YouTube notifications. If you want to get alerts from us on Instagram, simply follow us at ignition_time. That's our handle on Instagram. Also follow us on Twitter. Our Twitter handle, if you want real-time breaking news and alerts from us, is ignition_time on Twitter. Thank you so much for watching. If you learned something new from this video, please consider commenting below. Our community is growing very, very rapidly, and I invite you to join our family. Your vote of confidence for me and my team and all the effort that goes into this channel behind the scenes is you simply clicking that like button, you gently tapping that subscribe button, and you igniting that notification button. This way you'll get alerts from YouTube. Again, thank you so much for watching. Another way you can thank us is you can share this video with friends and families. That would be, again, your vote of confidence in us and all the effort that goes into this channel. Once again, we release videos at 2 p.m. East Coast time most days of the week. That's 2 p.m. East Coast time. Thank you so much for watching. I'm looking forward to seeing you in the next episode of Ignition Time. Take care. Bye.